Hi, everyone. My name is Yoobin. I'm the CEO and co-founder at Quip Medical, and we're bringing the joy of medicine back to physicians. So I distinctly remember the first day I became disillusioned with the field of medicine. It was my first day in clinic as a first-year medical student, and I thought, today's the day. Today's the day I get to talk to real patients. It's the day I get to learn how to be a doctor. And instead, I learned how to write notes all day. The reality of today is that the majority of physicians waste 50 hours per month on unpaid paperwork. Now, some physicians may want to take that time back to themselves, and others may want to see more patients, but nobody wants to spend more time on paperwork. So should physicians choose to fill that time with additional work, that is a lost opportunity of 150 patient consults per month. To put things into perspective, that's about $9,000 a month worth of a physician's time spent on something you don't really need a medical degree for. And we want to fix that. Quip Medical has built the first true end-to-end clinical documentation ecosystem. Oh, why did it do that? Sorry. By using patient encounter notes to automatically suggest all relevant billing codes and maximize physicians' profitability. We started by tackling the biggest problem of paperwork with our AI scribe, but realized that there was something missing. So we started building out features for post-consult paperwork. And still, there were evident shortcomings of these AI scribes existing on the market. And that's when we dove deep into insurance and medical billing, a promising market with proven products that have set exciting precedents with acquisition from large corporations. So existing solutions have tried to automate the note-taking of pre and post consults, referral generation, and some have automated both, such as Mutual Health. And if you work in the health tech sector, maybe you've heard of billing support from platforms such as Dr. Bill or Dr. Care. At Quip, we've built all three. Not only do we follow the standard PIPEDA and PHIPAA guidelines and provide end-to-end encryption of patient data, but unlike our competitors, we go the extra mile by de-identifying transcripts prior to the processing of notes. Furthermore, our aforementioned billing feature ensures that codes are limited to the context of the consultation and also guarantees that doctors aren't missing out on money that they should be getting paid. We are the first Canadian AI scribe to offer this additional feature. We're not just here to save physicians time, we're also here to save them money. To begin, Quip, doctors simply press the mic at the center of the screen to start a recording. From there, doctors can take the time to look at the patient and genuinely listen to their concerns without worrying about documenting the consultation simultaneously. At the end of the assessment, physicians stop the recording to initiate processing of the summary note. This summary note is automatically synced to our web app, from which physicians can seamlessly copy the note into their respective electronic medical records with one click. From our web app, physicians then have the option to retrieve all relevant billing codes based on the scope of the note. At the end of the day, doctors are present, patients are happier, and notes are more precise. Our users are already seeing the benefits. Family doctors, nurse practitioners, and so many others have told us that they simply can't go back to the way things were. Those canceled dinner plans, missed good nights to kids, or patient rapport, all now prevented with the use of Quip. We currently have 30 beta users on our MVP platform across both Canada and the US with zero churn thus far. In addition, we've recently partnered with the Department of Family Medicine at the University of Ottawa to pilot our technology. And this partnership alone allows us to service a potential pipeline of over 100 affiliated providers across the city. To date, we've generated more than 4,000 notes across 5 clinics, demonstrating a time saving of more than 400 hours in total. Despite our rapidly growing user base, we've been able to maintain a low unit cost of less than $2 per user, timing us well to scale in the near future. We currently offer 2 business models depending on the consumer profile. For individual physicians or small clinics, We offer a monthly subscription model, while larger family health organizations or hospitals can contact us for a custom enterprise deal to negotiate annual licenses. From each of these models, we currently have an MRR of $2,000 with $50,000 more in ARR currently in the sales cycle. And this would bring our MRR to $6,000 by the end of 2024. Now, looking forward, we plan to expand into larger markets to reach profitability by our third quarter next year. And yes, we will be going into the go-to-market strategy with the upcoming 2 slides. Now, with 5.2 million total potential users encompassing physicians, nurse practitioners, physiotherapists, and other allied health professionals across North America, we are currently targeting a $9.4 billion serviceable attainable market, with avenues to eventually target a $25 billion market globally in the near future. At present, of the 100,000 physicians practicing in Canada, more than 30,000 reside in the province of Ontario, allowing us to target nearly a third of the country's total physician population using our new OHIP billing support. Furthermore, estimates suggest that a significant portion of new doctors in Canada are millennials, likely making up around 30 to 40% of the physician workforce, with Gen Z quickly emerging as a growing demographic. Both populations poised to accept the imminent technological innovations in healthcare. To date, we've incorporated an AI scribe and optimized billing code suggestions into Quip's ecosystem. In addition, we've partnered with the U Ottawa's Faculty of Medicine to launch pilots, quality improvement studies, develop a French integration, and provide adaptations for use in affiliated retirement homes. To support this, we've already begun integrations with Point Click Care, the #1 EMR for long-term care homes. Now, looking forward, we plan to launch with more clinics and hospitals, as well as establish strong partnerships and complementary markets. Yes, we've already built billing suggestions, but we're preparing for something bigger. We plan to integrate and partner with select EMR platforms to provide easier workloads for users, as well as offer direct claim submissions to the Ministry of Health. This would allow us to pivot our current subscription model to a commission model, thus lowering adoption friction from users and increasing revenue potential by 3-fold per user. We've already validated that we can build and sell Quip as is. But with your support, we can expand Quip's existing ecosystem with these features in the pipeline and expedite our market share in sectors listed here on the screen. Now, none of this would have been possible without our amazing team of engineers, all graduates from the University of Waterloo. Our CTO has years of experience in publications and AI research, as well as its applications, and currently leads the AI model development, evaluation, and other related tasks to Quip Medical. Furthermore, his experience working in the fintech sector equips us with the ideal skill set to push our product forward. Our software development team seamlessly integrates these AI models into our mobile and web app. And it is because of their expertise that we've successfully built all of our core technologies 100% in-house. We are the team to bring Quip to the forefront of health tech innovation, and we hope you'll join us on our journey. I think we can all assume that doctors like talking to patients, at least most of them do. And if you are a family doctor, you like asking them about how the kids are doing, how that vacation was, or in my preceptor's case, about golfing. But as administrative burdens have continued to rise, this luxury of small talk has turned into a luxury that can no longer be afforded. I understand why documentation is so important. In fact, it is essential to quality patient care. But with the technology we have available today, why are physicians still forced to remain glued to their monitors when they so desperately want to look at you, the patient, instead? I didn't go to medical school to write notes all day. I came to help and connect with people. And I assure you that doctors feel the exact same way. Thank you.
Thanks, Yoobin. Okay. Laurie, do you want to?
How was the time? I didn't time it. Did you time it, Shane?
43. I did. It was 9 minutes.
Oh,
So you had
good.
some time. So you had a few more minutes if you needed it.
Did you want me to go first, did you say?
Sure. Yeah.
I thought, in general, it was a very good presentation. It was very clear. logical, and easy to understand. So I can just tell you about what the questions that were left in my mind.
Mhm.
Most important question, like I've seen 3 or 4 other companies doing the same thing. So the most important question of mine is, what's your differentiator? How are you different than all the other people doing the same thing? So a slide on competition would be very useful. And the trouble is with a slide on competition, you can only talk about the major competitors that are visible to you. The ones I've been talking to, you probably don't know about. So you really need to talk about just specific competitions, and then also just sort of what your key differentiator is, why you might be different than all the other ones that nobody's seen yet. So I think competition was a big question of mine and key differentiator. Second one, you sort of covered it, but anytime I see these kind of businesses, it's access to the medical records and integration of the medical records is key. So you mentioned it a little bit, but I think a little bit more detail on sort of which ones you're going to do and in what order. Like I said, we're going to do this one, which covers 40% of the market. Then we're going to do this one, which covers 30% of the market. Then we're going to do this one, which covers 15%. Something to just give a real sense of a real plan to cover the medical records business, because that's always a big issue with any kind of a business like this. And the third point was going to be the go-to-market strategy. Yes, it's a great product, but there's a lot of doctors out there. So it's almost like a consumer sale. And so the go-to-market strategy is difficult because it's not, you're not selling once to, maybe you're selling once to a hospital, but a lot of doctors are individual small businesses. So you gotta sell to them individually. And that's a big sales and marketing challenge. So a little bit more detail on your go-to-market strategy and how you plan on addressing all those, or finding all those doctors and selling to them would be an advantage.
For sure. Sorry, for the first third of the presentation, I had a huge mix up with my slides. So I apologize if the competition slide was like very brief. But no, that's really good feedback. Thank you so much.
Thanks, Laurie. All right, Kelly, you want to jump in here?
Yeah, I think you did a really great job. I think you had extra time, which you don't want to leave on the table. So use that time. Find the spaces where maybe you felt more rushed. I've got some feedback. I think what I really liked is the beginning, framing the problem. You did a really good job and you connected to it. So, right, I believe you. I believe that this affected you and you were motivated to do something. Doing the why at the end felt weird because you kind of did the why at the beginning and then you did the why at the end. So maybe just either grouping it, but it just felt, it didn't feel like the strongest start. It was important, but leaving it with the why when you did the why at the beginning felt almost repetitive. But there were good pieces in that end maybe you could bring forward. I struggled with, I'm a word nerd, so this is just a personal thing. I think words really matter, right? And you have a slide called current market, which I think was really good. You had kind of the 3 areas that people are focused on, which I think is strong. I think it could be better articulated and explained, because what you're saying is you understand the problems and you understand the competitors. To me, that was more, it sounded more like these are the current solutions in the market. Because then you talk about market in a different way. So you're using market in 2 ways, sizing the market, but also, so I think just clarifying that and being more clear about, yeah, we understand there's problems. Back to what Laurie said, there are competitors, and it's perfectly fine to say that there's enough room for all of us. There's some great companies out there doing these things. There's some great companies doing these things. We actually address all 3, and that's what's really unique to us, I think, is what I was gathering from it.
Yeah,
I would spend a lot more time on that. Like I would spend a minute on that. Because that is your differentiator, right? And it felt, and you handled it very gracefully too. I want to say that having slide mix up is going to happen. So the fact that you just were able to practice it is good. Handled it well. I was unclear about your 30 users, and don't be shy. If it's 30 people, it's 30 people. Is it 30 private practice? Are they 30 individual?
Specify what type of users those are.
Yeah. Is that a physician? And that's okay. And then it begged me to say, who is your target? Are you targeting private practice? Or are you targeting, right? And you sized your market and you had this beautiful, image with the dollars. And then you talked about, you have the great knowledge, but I didn't see anything that says, yeah, in Ontario, we've got 1,000. And, just being really clear about who your target audience is, because physicians is a big audience.
Yeah, for sure.
You have the answers, I don't, but that left me curious.
Uh-huh.
And I would be more focused, right? Maybe it's private practice, maybe it's physicians in this area with potential to reach more physicians. That's also a really good strategy to just talk about, we're targeting here, but as we grow and we gain more funding and traction, we see this affecting all I don't know your business enough. Partners, customers, maybe use cases, same thing, just framing it and making sure it's really clear. If you have, you again, there were sections where you mentioned on one page, I think the university, and then another one, a customer. Any way you can, like, now I've got to do mental math to say, okay, there's a little bit of research, there's a little bit of customer. Anywhere you can use a logo or an icon, way more memorable than reading a little thing on a screen. And I go, oh, that university, right? It's more memorable.
Uh-huh, for sure. Sorry, going back to your previous point about the specific type of users, so that would also tie back to what Laurie said about like being more particular about the go-to-market strategy, like who are we targeting, and then how are we gonna target that specific niche.
Yeah. Oh, you're on mute, Laurie.
Selling to a hospital and selling to an individual practice are two different things. One's an enterprise sale, one's a consumer sale. So totally different ways of going to market, and trying to do both of them simultaneously is probably going to be a challenge. So I think you sort of need to pick one initially.
Right. Okay. So it's just specifying what exactly the strategy is.
Yeah.
Okay, that makes sense.
Yeah. Who's your perfect customer, right? And it's clear you're early, which is great, and you've got a strategy to grow and get enterprise. But if it's private practice, that own it. That's great. That's fine. That's your customer, and your customer, which means you're going to also, leading into my next one, how are you going to reach them? So what is that strategy? How are you going to reach them? Is it, so there's probably approaches and techniques. And then I would say, I took a lot of notes here. Just the expansion goals as well. Perfect to see that. It's really important to know that you're not just going to kind of sit and rest on that. But again, a lot of words. It wasn't clear to me. Right. You had this clear definition of, we're addressing these three things. And then there's more, and I know there's expansion, but I didn't really get a sense of where you're going to take it. And maybe expansion is it marketing? Is your expansion how you're reaching people, or the fact that you're adding more features? And just be careful when you're early. That would just be my advice. You don't have to do it all, right? You probably want to focus on getting sales, right? And what's your strategy to get those sales? The art team, everyone does this because you want to give space for your team, because they bust their butts, and you want to that you could save minutes there. And I mean, those, no disrespect to your team, but you don't need to spend a minute. You've got credibility by the fact that you're more than just yourself. We're pretty quick leaders. And I would do more of a narrative and just say, this is our team. We have this experience together, and really proud of the work. And then you've got a couple more minutes.
The other thing that just occurred to me, you may not need to put in the presentation, but you need to have an answer to it, is what's the IT requirements? I mean, especially if you go after general practitioners, they don't have an IT department. So what do they need to do in order to integrate this physically into their infrastructure? They need to hire somebody to come in and reconfigure their network, or, I suspect it's simple, but you need to state that it's simple.
Yeah. Got it.
What do they need to do?
The presentation as well. Okay. Got it.
And then, sorry, I have one more. I had a lot. You mentioned zero churn, which is great. Which is great to say, but it didn't make sense to me, because I don't know what zero churn is. If I don't know, are they churning a monthly, or is it an annual fee? Doesn't matter, but just be and embrace it. But just clarity on what you mean by churn, and it's okay. So I need clarity on the users, and this one was important. This one was important. Sorry. And I'll put this in my notes so you don't have to remember it all. But you talked about you did a really good job connecting the problem to a cost. I love that more than anything, right? But then your testimonial had no connection to the cost. It was all heart, right? So are they saving money? Because your problem that you're solving is that you're saving money through that time, but your testimonials didn't reinforce that.
Okay, I tried to emphasize in the beginning that people can either use that saved time to see more patients and therefore make more money, or they can save that time for their own well-being. So it depends on what chooses to do. But I can definitely try to make that point more clear at the beginning as well.
Yeah, excellent. Overall, really good, really good. And use the time. You've got it.
Will do. Thank you both so much.
Great.